I want to guide you through the workstream for developing an economic model specifically tailored for a new diabetes drug we're evaluating. This journey not only encompasses rigorous analytical processes, but also integrates real-world data and stakeholder insights to ensure a model's relevance and applicability. We start by setting clear objectives for our model. For example, our goal might be to demonstrate the cost-effectiveness of our new diabetes drug compared to standard care, focusing on key outcomes such as glycemic control, reduction in diabetes-related complications, and overall impact on quality of life. Our target audience includes payers, healthcare providers, and policymakers, aiming to underscore the value proposition of our drug in managing diabetes more effectively and efficiently. Next, literature review and data collection. We delve into a comprehensive literature review and data collection. For instance, we gather data from clinical trials showing our drug's efficacy in lowering HbA1c levels, its safety profile, and its effect on reducing long-term complications like nephropathy or retinopathy. We also collect data on the standard care costs, including hospitalizations, routine management, and treatment of complications. Engaging with stakeholders is crucial. We consult endocrinologists, diabetes care specialists, and patient advocacy groups to understand their perspectives and validate our model's assumptions. For example, they might highlight the importance of medication, adherence rates, and the drug's ease of use, which we then incorporate into our model. The next stage is more technical stage. In the design phase, we choose a model that best fits our objectives. Let's say we opt for a Markov model, which allows us to simulate the progression of diabetes over time, accounting for various health states like well-controlled diabetes, uncontrolled diabetes, and diabetes with complications. We model transitions between these states based on treatment with our drug versus standard care, incorporating probabilities and costs associated with each state. We then input our collected data into the model. Through analysis, we might find that our drug, while slightly more expensive up front, reduces the long-term costs associated with diabetes complications, leading to overall cost savings. We validate these findings through sensitivity analyses, ensuring our model is robust under various assumptions. Interpreting the results, we prepare a narrative that communicates our findings effectively. For example, our analysis shows that our drug can save the healthcare system X over Y years per patient by reducing complications and hospitalizations, translating these findings into compelling visuals and reports for our stakeholders. We disseminate our findings through scientific publications, conferences, and direct meetings with healthcare decision makers. We engage in discussions on how our drug can be integrated into diabetes management guidelines and formulary lists, emphasizing its value in improving patient outcomes and reducing long-term healthcare costs. Lastly, we commit to an iterative refinement process. As new real-world data emerges or as healthcare practices evolve, we update our model to reflect these changes, ensuring our value proposition remains accurate and relevant. In conclusion, this workstream is not just about building a model, it's about weaving together data, expert insights, and real-world evidence to tell a compelling story of how a drug can change the landscape of disease management. This needs to work together with all of you, leveraging our collective expertise to make a meaningful impact on patient care and healthcare economics. Thank you for listening, and I'm now open to any requests and suggestions you might have